Namaskar. Welcome to Ahara Arogya Adhyatma, the light of samskara. Today we have Dr. Arun Kumar M. He is a pediatric and adolescent endocrinologist. He has done his MD from Rishikesh AIMS and worked in Delhi AIMS too. And apart from that, he has worked in Lady Hardinge Medical College and now currently he is an assistant professor of pediatrics in Chaluvamba Medical College, which is part of Mysore Medical College, and which is the oldest and the best college in Karnataka, one of the best. And welcome, Dr. Arun Kumar.
Thank you. Thank you.
Last time you told us about the type 1 diabetes, that is the diabetes in children. And today, let us find out how to treat these patients. Now, first tell us about the insulin. What insulin, how to take, and how many times to take.
As we have discussed previously in our previous episode, diabetes is a condition of, especially the type 1 diabetes in children, it is a condition of absolute insulin deficiency. That is, there is no insulin which is being produced inside the body. That's why whenever we eat, in order to reach that food into the cellular level, we need insulin. So every time the child eats in the morning, in the afternoon, and in the night, child has to take insulin before having food. And at the night time, at 10 o'clock, we usually give basal insulin, which helps to regulate the blood glucose for the whole 24 hours. So totally, it is a 4 doses per day.
Okay. And what about the type of the insulin?
We have two types of insulin. One is called as basal insulin, other is called as bolus insulin. Basal insulin is the one which covers the blood glucose fluctuations throughout the day. That 24 hours it will cover. And the bolus insulin is the one which commonly given as a regular insulin, and other analog insulins are also available. It is given before the food, usually 30 minutes before the food, so that it reaches the circulation, and whenever we eat, the amount of blood glucose which increases will be taken care by that insulin.
Okay. And I have seen in some people, when they repeatedly they take insulin, there will be like a nodular formation and the redness and allergic formation. How do they avoid this?
This is called as lipohypertrophy, madam, because whenever we give insulin, that causes increase in size of those cells which are present in and around the injection site. So, in order to avoid this swelling, that is lipohypertrophy, what we advise as a site rotation. So, they should not repeatedly give injection to the same site. They have to rotate the sites. We will teach them while teaching regarding the diabetes. There are the sites over the abdomen, over the back of the arm, and lateral side of the thigh. So, in those areas, they can change the sites and practice that site rotation in order to avoid that swelling that is called as lipohypertrophy.
Okay, okay. And the anything that worries about the diabetes most is the diet.
Yes.
The diabetes and diet, they go hand in hand.
Yes.
Now, adult, they have so many things available. For the children, what do you advise?
For children, there is no separate thing called diabetic diet. Previously, we used to follow the diabetic diet. Now it is a balanced diet. Whether it is a child of diabetes or without diabetes, for anyone, it is kind of a lifestyle modification. So we
Yes.
have to take the balanced diet where it has specified amount of carbohydrates, specified amount of proteins, and specified amount of the fats with
Okay.
associated minerals and micronutrients. And along with that, it should be a time diet, that there is a fixed timing for the all the meals. It is not like whenever we want then we will take. So it is always like a fixed meal, even for a person without diabetes as well. Along with that, it should be a matched meals. That means how much ever insulin we are going to give should be matched with the amount of carbohydrate inside the food. Every food will have different amount of carbohydrates. Like if we take ragi, it has lesser number of carbohydrates. If we take godi or chapati, it will be having more number of carbohydrates. The rice and other carbohydrates will have more amount of carbohydrates, and sweets will have extremely high amount of carbohydrates. Based on that, the amount of blood glucose will rise inside the body. So the amount of the food should be matching with the amount of insulin we are taking. In case sometimes kids will be like, today is a festival, mother has made a very good meal, I want to have one more extra chapati. That time we can't refuse. So what we
Yeah.
advise them is you can match, because you have given 4 units thinking that the child will eat 3 chapatis. Now the child is expecting one more chapati. So what you have to do is you just give another unit of insulin. We will teach them how to read a carbohydrate ratio. So how much amount of insulin required for how much amount of carbohydrate. So if the child is asking for one more chapati, give an extra unit of insulin. Let him take that chapati. So it should be
Okay.
always.
Okay. That means to calculate that they must know the blood sugar. So how do they check the blood sugar and how many times do they check?
It is just like a speedometer of a car. Whenever we
Hmm.
are driving, we'll be looking at the speedometer. What is the speed limit? Okay, in a highway, it is 100. So we should not go extremely above that or extremely below that. You have to maintain a constant speed in that range.
Hmm.
Similarly, to maintain our normal blood glucose, we should be checking something. Just by looking at the patient's face or just by seeing something, we cannot make sure that what's the blood sugar levels inside the body.
Hmm.
So in order to know that, we will check the blood glucose 30 minutes before the meal so that we
Hmm.
decide how much of insulin needs to be given and how is the blood sugar control. And after 2 hours, in order to see whether the amount of insulin given and the amount of food taken, they both matched and the blood sugar remained stable. So similarly, in the afternoon and in the night, before meals and after meals we do, and at night 2 a.m. also we do. Totally seven readings per day we'll be doing.
No, but 7 readings per day for the child, it will be very difficult. No, do they have any other option rather than pricking and getting the blood sugar?
Yes, ma'am. We have something called as continuous glucose monitoring. It will be
Hmm.
just like a small disc,
Hmm.
which will be of a 1 rupee coin size.
Hmm.
So, which will
Hmm.
be inserted over the back of the arm, and it will
Hmm.
be completely painless. It will be
Hmm.
continuously measuring blood glucose every 5 minutes, and it will
Hmm.
be showing in your phone or a device. So, in that,
Hmm.
you can just tap the device or phone near the
Hmm.
reader,
Hmm.
and it will show you
Hmm.
the reading. And it
Hmm.
will give us a graph as well, like every 5 minutes, how was the blood glucose during exercise, how was the blood glucose while taking food, how was the blood glucose. But
Hmm.
because of the cost issues, most
Hmm.
of the patients will not be able to.
Yeah, they can't afford it. Now, but like how we have the oximeter, which gives, do you have anything in between the checking or this oximeter? Anything is available like that?
Presently, nothing yet, ma'am. So CGMs are the standards which are present in the market. So
Hmm.
we are yet to get such kind of technology in the diabetes management.
Okay, okay. And what about the exercise? Because for the adults, we say that any exercise, yoga, the blood sugar will definitely come down. In order to control, you have to walk. But then, in the children, the mothers are scared. Suppose the child falls and injures, it may not heal because of the diabetes. So, what exercises and how do you advise them?
Yes, ma'am. Exercise is like a medicine for the children with diabetes.
Hmm.
Like the amount of work a 5 unit insulin is doing, it can
Hmm.
be done just by 3 units with the exercise. Hence,
Okay.
children with diabetes should do regular exercises. We advise them to do at least minimum 1 hour of physical activity per day, which can
Okay.
include jogging,
Hmm.
running, jumping, swimming, cycling, skipping. So all those things they can do. And along with that, 3 days in a week are core muscle strengthening exercises like
Hmm.
yoga, and they can do simple dumbbells activities, and they can do simple gym activity as well.
Hmm.
But we always afraid that in case they get injured, it will not be healed.
Hmm.
Because if the blood glucose are in good control, the injuries will be healed as per a normal person as
Yeah,
well.
okay.
The
Okay.
blood glucose are
Okay.
not in control, then it will be a problem.
Okay, okay, okay. That means like exercise is also like a treatment and that
Yes,
can reduce the amount of insulin required. So that
yes.
is important. So how do you put all these things, together?
Together, it's a journey. Diabetes in children, it's kind of journey inside a car. In order,
Lifelong
yes,
journey they have to
lifelong
drive.
journey. In order to drive that car, in order to that car to move, we need four wheels. The most important wheel is a insulin,
Hmm,
and the other wheel is our diet, and
hmm,
the third wheel is our blood sugar monitoring and maintaining them in a good level, and the fourth one will be exercise.
hmm.
Along with that, the driver should be confident and he should be joyful and enjoying the ride so
Yeah,
that
yeah,
the
yeah.
diabetes car should be
But
moving.
how do you make them enjoy their life? Because as it is, they are depressed because they have to inject daily. and then they can't eat the sweets. And then, though the diabetic sweets have come now, the sugar-free sweets have come down. Do you advise them to take any sugar-free or not? Because some of the sugar-free substances, they can cause coronary artery disease in the later stage. So how do you advise them?
Actually, we advise them to stick to the balanced diet as we have discussed already. It's always that most of the fruits, because except that extremely sweet fruits, we tell them to take most of the
Yeah,
fruits.
except like chiku and mango,
Mango, yes,
probably, and the grapes. They have a very high level of sugar. So rest they can be taken,
they
I
can be
think.
taken.
Okay.
So that will
Uh,
have some amount of good amount of sweetness, so they can
mm.
take it. Presently, there are no standard recommendations for taking these sugar-free things in
What
children.
what about what about the ice cream?
Ice cream is the one which has a very bad glycemic index. As soon as they take
No.
the ice cream, it is like spiking their blood sugars inside the body. So we
Okay.
always avoid the ice
And
cream.
what about the biscuits and the cakes and the junk foods?
Whatever things which are made by maida is always avoided, madam.
Very
It's
bad.
not like they should not be taking even on their birthday. I have told, we teach them carbohydrate counting. Occasionally, some 6 monthly ones or yearly ones, they can take small amount. That should be in a balance. That is the catch in diabetes. It should be always balanced and it should be managed well according to the body.
And what about these fizzy drinks which contain the sugary syrup, the drinks that they take?
They are all no, even for diabetes and non-diabetic children as well. It's
Yeah.
diabetes, diet, and exercise. Other than insulin, the management is just like a lifestyle
Same as
modification,
any other child.
which should be followed for a normal children as
Okay, okay. So how do you inculcate confidence in the parents as well as the child?
well. Actually, when we tell the parents that the child is having diabetes, they are the one most shattered rather than the children, because the children are the mirrors of the parents. So whatever
Yeah, if
feelings we
the
have, they
dreams,
just
yeah.
reflect. They just reflect it. If we are angry, if we are depressed, they will just reflect the same thing. If we are confident, if the parents are confident, then the children will also feel, yes, we can do it. Yes, there will be ups and downs. It will be a difficult journey, but yes, definitely possible to lead a good life with good amount of confidence, and parents being very helpful for the children and being supportive for the children. We
Mm.
should never tell the children like you are a diabetic child. Never label them as a diabetic child. Let
Mm.
them get involved in all the activities. Let them play. Let them go to the trips. But be on a disciplined life,
Careful.
careful and
Better to be
disciplined.
careful and
Yes,
disciplined, so
yes,
that they don't miss the insulin and they don't overeat something, and so
yes.
they have to read a very discipline. I think it is in order to teach the discipline, the disorder has come. It appears like that because nowadays children have got no discipline at all. Absolutely no control on anything. And finally, what are the tips that you would like to give to the parents?
Never think like something very bad has happened. Maybe some 100 years back when there was no insulin, people used to think, because people never used to survive diabetes. Diabetes was like a death sentence. Now, with all the advancement, with the good insulins, with the good support, now the children can lead a normal life as any other
And
children
the
before.
normal
Normal
span
span
also.
also. It is just
And
hardly.
ultimately, even if the complications occur, we have the surgeries to take care
We
of that.
have the treatment for everything. So it's always like diabetes.
Yeah.
Yes.
Okay, then. Yeah, thank you very much for your kind and such a beautiful narration of everything. And I hope all the listeners and especially the parents with the diabetic children, they are benefited by your advice. Thank you, sir.
Thank you, madam. Thank you very much.